Coming up next, are you less active? Is your mother or your father or your family member becoming less and less active because they're having so much pain when they walk? You may have this condition called lumbar canal stenosis, but something can be done about it.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
Welcome back. I'm Dr. Carrasco.
I'm Dr. Alex De Jesus.
We're talking about pain and pain-related conditions. We're talking about now a very common condition that affects people as they get a little bit older, generally in their 50s or longer, but it also could cause a lot of difficulty for them and their family, Alex.
I think we're talking about a condition where the patients have a lot of symptoms and they're going to come to us, but they don't come early enough. It takes them a long time to get to the doctor.
Well, most of the time you have a daughter or a son or maybe even a husband or a wife that brings the other person in because they're less active now. They walk for 5 or 10 minutes and they got to sit down. And they sit down and the pain goes away. They get up, they walk again. But that's really what affects them the most is that the mom or dad or my husband or my wife doesn't want to be as active as they were in the past.
I had a patient last week, she said, I'm here with mom because she's just becoming lazy. That's what she takes. She said she don't want to walk, she don't want to go to the supermarket anymore.
Well, they don't realize that she don't want to go because she don't know where she's going to sit. So people say, I don't mind going places, but I need to know where I can sit down. They don't want to go to a place where they got to stand all day and essentially end up in pain the whole time. So this is a condition called lumbar canal stenosis.
She's slippery.
When she falls, that's the problem.
Yeah.
Let's talk about what we're talking about here. So let's talk about the spine. This here is the cervical part of the spine. There's 7 of these. The thoracic or the mid part of the upper back, there's 12 of these. And the lower 5 are called the lumbar part of the spine. Right here is a canal. And if this disc that sits up here bulges back and these joints grow in, this becomes stenotic or becomes narrowed, and that's what causes the pain. It pinches on the nerves. So when someone's walking, it's going there and pinching on the nerves, causing discomfort. And once they sit down, it gives them more room and it has less discomfort.
There's some people that are more risk to canal stenosis than other people.
Yeah, people who are older generally starts in the 50s or so, but generally 60s or 70s. People who have degeneration of the spine, people who have osteoporosis where the discs are getting narrowed to begin with. All those are people who are at higher risk for having this condition.
Sometimes you get the reading from the radiologist. The MRI says congenital, smaller canal, so they kind of were predisposed. Some people were predisposed to this.
Well, like a lot of different things that happen in the body, you can be born with a normally, for them, abnormally small canal. But, this is a canal stenosis. It can be treated with anti-inflammatory medications, can be treated with muscle relaxers, can be treated with rehab. But when that doesn't work, we do what we call epidural steroid injections.
How does that help the patient?
Well, there's inflammation here. And what happens is the nerve used to fit, pretty easily now. And now as the nerve's getting more pressure, it's swelling. And because it swells, it causes pain. What we need to do now is try to figure out how to make this hole bigger. You can do surgery sometimes to make the hole bigger, or you can just put some steroids there to make the nerve smaller and give it more room.
So the treatment of this is not just an injection, but it's all together. Is that and the exercise and the rehab? A lot of people like to skip that part.
Well, I'll tell people if I do 2, maybe 3 injections, 2 weeks apart, each one of them, and do the therapy, you'll only get better, but you'll feel better and you'll be more active.
Are these people at risk of falling? I mean, they get that bad where they can't coordinate and fall?
Yeah, if it's real bad, they narrow the spine so much that the nerves now get weak and they make the muscles get weak and they fall. But that's not very common. What we see, though, is the fact that people become less and less active over time.
When I have my patient on UFA comes into my office with a walker, and the first thing I ask them is how long you've been on that walker and who prescribed it and why, and they don't know why. And when you look, they have canal stenosis.
Well, but that's exactly right, Alex. People eventually get less and less active over time thinking it's part of aging, but it's not. If you have this condition, if you have pain when you stand or when you sit, and you have to sit to make it go away, you may have this condition called lumbar canal stenosis. See your doctor, get some help.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.